Manager, you want to hand it off?
Sure. Mayor, Council, as the mayor said, there is some positive news, but we as a community, as a country, are still in the middle of a pandemic, and it's going to take a continued and sustained effort from all of us. And we have incredible staff that are really on the front lines of this. And so with that introduction of appreciation to our staff, I'll turn it over to Director Hayden.
Good morning. Stephanie Hayden, Director, Austin Public Health. Thank you, Spencer. Thank you for the opportunity to provide an update today. Our staff continue to contact trace with target populations. We are constantly reviewing and providing updates to our materials as we move along the process. Every Friday, we provide a non-nursing home cluster update with the daily report from communications. We continue to prioritize our Spanish translation, as well as ensure that we have nursing services that are available on our nurse line, as well as our contact tracing. With our testing efforts, as you may recall, the department submitted a plan for COVID-19 tested and related epidemiological response activities for calendar 2020. We submitted that to the U.S. Secretary for Health and Human Services in compliance with House Resolution 266. And our plan was completing 10,000 tests in May, 40,000 tests in June, and 60,000 tests in July. This is a combined effort with Austin Public Health, as well as we've received assistance from the state of Texas, our hospitals, our public and private clinics, as well as our private physicians. And so we were really excited to provide over 60,000 tests this month. And we continue to have the ability to test over 6,500 people every week. We are continuing at our testing location, our walk-up sites at Dove Springs, Givens, and Walnut Creek Library. And we are providing evening and Saturday services at those locations. If individuals are unable to, those are walk-up sites. And so we also continue with our drive-up site. If you're unable to go online and register, we urge you to call our nurse line. You can call 311. Our nurse line staff will get you set up and registered and schedule you an appointment. With our long-term care incident management team update, overall, there's been a decline in requesting for testing, strike teams, and PPE since our last update in July. And this is just coincides with what's happening across our community. Year to date, we have tested 8,338 tests, and a total of 47 long-term care facilities have been tested. We are now assisting other agencies with their testing needs. This testing requests have decreased, but what we are noticing is that nursing facilities are testing all their staff weekly on their own. As you may recall, the Texas Health and Human Services Commission stated in order to move to a phase 1 facility design, which allows them to have visitation. So they are providing those services, and we are providing technical assistance as needed. With our strike teams, they have a primary focus, as you may know, of stabilizing our impacted facilities. And so we provide those as needed. And also we provide models of PPE. So year to date, we have deployed 19 facilities. There have been a total of 308 strike team operational days. And on average, they spend about 15 days at each of those facilities. In addition to that, staff have provided some training to the strike team, as well as assisted them with their N95 fit testing and teaching them about donning on and donning off all PPE. Our strike team requests have also declined. For our PPE provision, we continue to provide that as requested. We have provided 224 PPE orders as of this time. That includes N95, respirators, gowns, gloves, surgical masks, etc. Our long-term facilities, over 100 were offered a one-time. 35 of them took us up on the PPE pushback, which provides all of that information that I provided. It also includes disinfectant and other supplies. Our weekly deliveries of PPE have been provided to facilities that have clusters and cases. So we continue to provide that to them as well. With our homeless update, we have 5 pro lodges that are operational. We have 333 guests there. Integral Care continues to assist us with on-site behavioral health services at all of the protective lodges. Downtown Austin Community Court, Front Steps, Salvation Army, Communities for Recovery, and Integral Care are providing the housing-focused case management and supportive services. In addition to that, Community Care is providing weekly on-site services at 3 of the lodges. 25 individuals have exited to permanent housing. So we're really excited about the individuals that are exiting to permanent housing. We're continuing to do testing in that community. We have tested over 680 individuals that have been in shelters or encampments across the city. We're continuing to provide the hygiene resources, which is the mobile showers and the stationary showers. And we've been able to provide over 2,000 bags of shelf-stable food each week. We have a contract on the agenda, excuse me, with Cisco on the 27th for additional food bank services with the food bank. In addition to that, just as a reminder, the U.S. Census is going to be conducting a count of homeless people, and they're going to do that in September of this year. Our outreach partners have continued to come together. APH, Host, and other city departments have partnered with Downtown Austin Alliance to provide bottled water, masks, COVID education materials, and other outreach efforts. With our community distribution, our staff, our health equity task force continues to partner with community organizations. We have established the top 6 areas where we need to provide PPE in those areas. We have partnered with agencies this past weekend and this weekend coming up. And so we have a list of our zip codes that we are providing those services in. The city is working on a 6-week campaign with Central Health, Community Care, and Travis County around messaging, as well as we'll have PSAs and do PPE distribution. The goal is to provide PPE in targeted zip codes in order to really provide that service to the communities where we see the positivity rate is higher. Our PPE distributions this past weekend were in the 78741 in the 4 area, as well as Del Valley. We have another event this weekend at Gus Garcia, and we are working with the Housing Authority to provide some PPE to senior properties. As we continue to work through with our PIO, we are really working closely with all populations. Our staff will have a memo that will be sent out later this week to a mayor and council to provide an update about the Latinx services that have been provided. Our staff have also have been working to increase language access at all of our neighborhood testing sites. With our, we've been providing some testing in group homes. What we were noticing is that there were increase in the number of group homes, and so we're coordinating with Integral Care to address those settings. We are also providing isolation and quarantining on site, but we're also assisting them with fit testing and PPE as well as the N95 mask. With our childcare and schools, as you may recall, on the 14th, we released the school reopening interim guidance, and staff are working on an FAQ. What we have established for technical assistance and questions for schools is an APH school info at austintexas.gov. That is set up for all schools from pre-K to 12, as well as we have another mailbox for childcare providers where they can reach out as well. We've provided some additional nurses to our nurse line to build capacity for the reopening of schools. So we are able to track any COVID-19 cases that come through and establish a report in that space. We also have been able to provide our childcare providers curbside pickup this past Friday and Saturday for health supplies. This was a collaboration between Austin Public Health, Travis County AgriLife Extension, and Workforce Solutions. So we were able to provide over 140 of those packages. We are working on additional information to solidify our task force and focusing on pre-K through 12. We are also working with colleges and universities where they may have additional information and support that they may need from the department as well. So as we continue to work in this space, and we know we need to set up additional areas to provide the technical assistance in the space. And so we will be doing the same thing for colleges and universities. That concludes my report. I'll pass over to Dr. Escott.
Thank you, Stephanie. And I'll ask AV to pull up my slides. Perfect. Thank you, Mayor. Thank you, Council, for the opportunity to update you on our COVID-19 data. Next slide, please. Sorry, there seems to be okay, I can see it now. There we go. So I want to talk a bit about cases first. There's been some chatter on social media about are we plateaued or not. So it's important that the council and the public understand that when we talked about the plateau that we've been seeing, it's related to the new cases. You can see that since about July the 29th, we've been relatively flat. We've had some oscillations up and down, but we're having trouble breaking through that 200 barrier in terms of the 7-day moving average on new cases. I will say that part of this, it seems, is a result of the data dump, as we call it, that we saw from the state due to a delay in reporting of earlier cases. Some of those cases that we've received in the past 2 weeks were from as far back as April. We had many in June and July as well. So what we've done is we've asked our team to look at the delays and see what proportion of the cases that we're receiving in and reporting are greater than 2 weeks old, meaning they're no longer active cases. So when we look at that data, it turns out that over the past 2 weeks, about 50% of the cases that we're reporting are no longer active cases. And this is largely due to that increasing data that we're receiving from the state from old cases. So while right now this appears to be plateau with some oscillations, we have evidence now that supports the fact that our cases are likely actually declining more substantially. Next slide, please. We can see the new admissions, which has been our key indicator up till now regarding our staging of risk. And that's based on the fact that it is not as vulnerable to variations in testing and turnaround times and so forth. We can see that with our new admissions to the hospital, those have been steadily declining. We saw that we had a rapid decrease towards the end of July. It flattened out a bit, but was still on a decline, and now is declining a bit more rapidly. As the mayor and city manager said, I think this is a reflection of the work that is being done across our community by individuals taking on the responsibility of protecting themselves, protecting their families, and acting in a protective way. And that's certainly resulted in what we're seeing here. Next slide, please. When we look at the overall impact on hospitals, we can see the total hospital beds being utilized in the blue. We see ICU admissions in the orange, and the gray is the individuals on ventilators. All those numbers continue to decline. And we can see that right now we're in a very good situation, less than 200 admissions total on that 7-day moving average. And we continue to see decreases in the ICU and ventilator use as well. In talking to our healthcare executives, and we meet with them every week, it's, the reports that we're receiving from them is that the hospitals are in good shape. There's plenty of hospital beds, plenty of ICU beds right now, plenty of ventilators. So for individuals who've been putting off elective procedures or going to the hospital for an evaluation, or even seeing their primary care doctor for physicals or vaccinations for themselves or for their children, there's plenty of space. Now's the time to go. Next slide, please. Mayor and Council, this is an update on the demographics associated with hospitalizations. I'll point out that we've, in the green line, we see our individuals who have identified as Hispanic, a slight decrease, but relatively flat over the past couple of months. Again, still overrepresented in terms of their representation in the Travis County community. We're seeing steady increases in the blue line, which is our white non-Hispanic, and relatively flat in terms of our African-American population, which is represented in the gray. Again, that line also overrepresenting that community in terms of hospitalizations as compared to the representation in Travis County's population. Next slide, please. This is a representation of the hospitalizations based on age group. We can see last week I talked about the sharp increase in that 70 to 79 age group, which is that mustard yellow color, which still is accounting for the highest percentage of hospitalizations this week, but certainly decreased as compared to last week. You can see a sharp increase in that 40 to 49 age group. And you can also see an increase in the bottom, the gray line, at that 10 to 19 age group, which is now representing 4% of all the individuals hospitalized. Now, again, the numbers of individuals hospitalized is dropping, but we are seeing that younger age group, that group who is going to school and to college, is increasing. So 4% represents the highest number to date as far as percentage of hospital admissions in our community. Next slide, please. This is an update of our nursing home and long-term care facility outbreak. You can see that several institutions, excuse me, have dropped off this week. We've got 2 additional ones that have gone 3 weeks without a new case. and our hope is that they will drop off next week. Overall, our number of new cases at 58, which is a substantial decrease from last week. As Director Hayden said earlier, we're seeing decreases in the requests for strike teams and other supplies due to the fact that the nursing home situation is now improving. Other long-term care facilities also improving. But we'll continue to track this. We will continue to offer support to those facilities. And we're grateful for the fact that many of them have instituted their own measures, their own PPE and testing, as Director Hayden described earlier, which is taking some burden off of the public resources to do that. But again, we will continue to support those efforts. We have lots of vulnerable individuals in our community, but the nursing home and long-term care facility still represents those who are at highest risk for hospitalization and death. So we have to continue our vigilance for this group. Next slide, please. Now, Mayor and Council, I want to talk a bit about positivity. I've talked about this for the past several weeks, but I want to hone in on it a little bit more. We're pleased with the fact that we've got a number of collaborators who are providing weekly feeds of testing data. That includes positive and negative feeds. And this was done in collaboration with UT and Dr. Mike Pignona, who led this group and helped us bring this data together. So we're grateful for their partnership. But what we're seeing is a data feed which constitutes now more than 160,000 data points, positive and negative tests. Looking at this data compared to all of the cases reported in Travis County by the state, it represents about 87% of all the cases, all the tests being done. So it is a representative sample of that testing effort that's being done. And what we can see is since week 27, we've had a progressive decline in the positivity rate. We are in week 34 now, but we're only showing you the data up to week 32 because we are still refining those feeds. We still want to make sure the feeds are timely enough that the immediately prior week and current week are not going to change much before we present it. But the last week that we're showing you here, week 32, shows us that we have a 7.6% positivity rate overall in our community. I can tell you that week 33, last week, shows a decline even further, around 5 to 6%. But again, we are still expecting some additional data points from week 33 and certainly week 34, which we anticipate sharing with you next week. Next slide, please. Again, it's also important to understand that there's substantial variation across our community in the rates of positivity. I showed this to you last week. This is updated this week. And this is showing us a breakdown by race and ethnicity of those positivity rates. The red dotted line is the 5% mark, which we would really like to get everybody below, including the entire community. But we have more work to do. And what you can see here is that our African American in blue and our Hispanic or Latino group in the gold color are still close to or exceeding in the circumstance of our Latino community that 5% mark. So we have a lot of work to do. We should not be happy as a community unless all of these lines are below 5%, or pretty darn close to it. And what does this mean? Does this mean that we as a city government or county government are entirely responsible for this? No. But it does mean we have to look at our efforts, we have to look at opportunities to increase those efforts, and we have to continue to engage other community partners in helping us fight this. I'm pleased to hear stories about private businesses partnering with community groups to provide supplies, including PPE. Those efforts need to continue. If we have individuals in the community who want to know what they can do to help, they can donate to these groups. They can give them PPE, they can make cash donations, they can support this effort to target and support our communities of color. If we've made one revelation over the past several months, that is, we have to be a community together as one. And we cannot be successful as a community unless we're all successful. And that means we have to focus on those who are still struggling with their infectivity rates, and we have to push them down. And that's going to take all of us. Next slide, please. This is a breakdown of positivity by age group, and I'm showing you week 31 through week 34. Again, as I pointed out last week, that blue bar, that 10 to 19 age group, is continuing to be high in terms of positivity, as is the green bar next to it, the 1 to 9 age group. This is concerning because as we are looking at starting schools in a couple of weeks, we have to ensure that we are testing this group of individuals, that we are encouraging as parents, that those individuals are not engaging in activities which is going to increase their risk of infection. And that means staying home when they can, and when they are going out, that they are going out in a protective way, wearing masks, social distancing, and paying close attention to that hand hygiene to reduce the risk of infection to their mouth, nose, or eyes. Next slide, please. Mayor and Council, this is a breakdown of our top zip codes. This is from our APH feed. Again, you can see that some of the zip codes that we focused on before continue to be problem areas for us. We anticipate that later this week or early next week, we will have a relatively live feed related to positivity rates in particular zip codes, so that you and the community can follow where the hotspots are, so that folks have a bit more information about where those positive tests are coming from. And it'll help us as public health, as the city and county and community, to focus resources on those areas that are experiencing the greatest challenges. Next slide, please. So I want to talk about our staging, and we've been at stage 4 for quite some time now. We had concern regarding the plateauing out of cases in the midst, at the same time, of decreasing hospitalizations. Now that we have the evidence that many of the cases that we've seen over the past 2 weeks are in fact old cases, and as a result of the state delay in reporting, I feel confident now in making the recommendation that we change our staging risk to stage 3. So what does this mean for us as a community? It means that we still must act in a protective way. We still must mask and social distance. We still must pay close attention to our personal hygiene, particularly our hand hygiene. And we must continue to avoid social gatherings and gatherings of greater than 10 people. This is particularly important for those who are at higher risk or who live in households who are at higher risk. So those over the age of 65 and those with significant underlying health conditions that may lead to hospitalization and death. This also means that even though we're in stage 3, we must continue to act as if we were in stage 4, if at all possible. And why is this important? Because we are approaching the start of school. We are approaching the time on September 8th when we want to send our children, to some extent, back to school. We have colleges and universities opening right now. And it's important for all of us, including those young people, to continue to act in a protective way so that we can drive the positivity rate down, we can continue to drive our cases and hospitalizations down, and we have a better chance of sustaining operations of our schools, our colleges and universities, and our businesses. Next slide, please. So, Mayor and Council, I've got a few slides, and I want to talk about some fiction and facts that are out there on social media to clarify some of the information that we're seeing on social media. So a few things that have come up in the past couple of weeks that I want to address. One is that face masks can cause pneumonia, bacterial or fungal pneumonia. This is fiction. So the fact is that there's not any clinical evidence to support the conclusion that it leads to infections like this. We have a very long history of healthcare workers who wear masks, other occupations who wear masks for an extended duration of time, and no evidence that these things are true. Second one, that face masks can cause toxic levels of carbon dioxide, also fiction. Again, there's no clinical evidence to support this conclusion. While some individuals may get anxious when they wear a mask, usually it's because they're new to wearing masks. We certainly see this with new healthcare workers. But the fact is that once you get used to it, that anxiety generally decreases, that hyperventilation generally decreases, and people become accustomed to wearing masks. I bring this up particularly because it's important as we look to September 8th and the reopening of schools to some extent. It's important for parents to start introducing their children to mask wearing if they're the appropriate age group to wear masks. It is part of what we have to do this fall semester in particular, and possibly into the spring until we have a vaccine which is widely available. And these steps to introduce that mask wearing regularly will help them become accustomed to doing it. Next slide, please. So one that has been in the media a lot recently is misinformation relating to the assertion that suicides during COVID-19 have outpaced deaths from COVID-19. This is also fiction. The fact is that COVID-19 is the third leading cause of death in the United States and the fourth leading cause of death in Travis County as compared to our 2018 death statistics. There's no evidence in discussion with the Travis County Medical Examiner. There's no evidence to support that COVID-19 or that suicides during COVID-19, so the first 6 months of 2020, are higher than they were in 2019. In fact, there's some evidence right now that those rates of suicide are lower than they were in 2019. Again, there is some delays as it relates to death statistics. We don't usually calculate them mid-year, but when asked to do that, this is the response from the Travis County Medical Examiner's Office, who is responsible for investigating and determining cause of death. Next slide, please. So another statement that I've heard that I want to clarify, that seasonal influenza is more dangerous than COVID-19. This is also fiction. The fact is that more than 176,000 Americans have died from COVID-19. More than 11,000 Texans have died from COVID-19 since the beginning of this year. The CDC estimated that last year, the 2019-2020 influenza season resulted in 24,000 to 64,000 deaths, which of course is eclipsed what we've already experienced with COVID-19. CDC also estimates that 3,516 Texans died during that same influenza season, again, being eclipsed by COVID-19. This is a dangerous disease. It is particularly dangerous for our elderly individuals over the age of 60 to 65, for those with significant underlying health conditions, and for our communities of color. So we need to ignore the fiction that we're seeing in the media and particularly social media and understand the facts. And that means that all of us have to use reliable resources to get information on COVID-19 and be very skeptical of information that is seen on social media. And with that, Mayor and City Manager, I'll turn it back to you.
Mayor, I've got a question. You're muted, Mayor.
You're on mute, Mayor.
Thank you. I'll get right to you, Leslie. Dr. Escott, what does it mean to go from orange to yellow?
So Mayor, again, the big change is the group size. So going from 2 to 10, but still avoiding social gatherings. Again, individuals who are in that high risk category should stay home. They should only go out if essential. And if they're going out, they need to be very cognizant of their spacing, of the hand hygiene. And ultimately, it's best if they can have other people go out for them to get groceries, to do that instead.
So right now, with respect to schools, a lot of schools are staying closed until September 8th, right after Labor Day, and then trying to open up a lot of that virtually. Is there a link between the overall infectivity in the community and our ability to be able to sustain the opening of schools?
Mayor, we think so. Again, we don't have a lot of evidence right now regarding infectivity in schools. We don't have a lot of evidence on how it spreads inside schools in the United States. There's some evidence from other places around the world. We have to understand that schools in the United States are different from schools in Sweden, in Germany, and other parts of the world. We know, and we've certainly seen on multiple occasions from other states who've opened early and allowed all students back to campus, that often results in shutting down very soon afterwards. This is why we made the recommendation that regardless of the stage of risk that we're in on September 8th, that the schools only open up to 25% of their capacity to allow us to refine our processes, allow the teachers and the staff and the students to work out the kinks in the system, and to ensure that we can do that effectively without significant spread before we start introducing additional students into that space.
Okay, coming up right now, we have the Labor Day holiday. Our community had a peak soon after the Memorial Day holiday, no peak after the July 4th holiday. Any special suggestions or warnings to the community with respect to the Labor Day weekend?
Again, Mayor, I think the same warnings that we gave July 4th are true now. If you're going to have a gathering, make it only the individuals within your household that you have regular contact with. This is not the time to invite family and friends over beyond that, because we have to continue to act in that protective way. We can still gather, we can still get together. We should do that virtually whenever possible. If people make the decision, regardless of my advice not to do it, if they make the decision to have those gatherings anyway, then they should be done in a way which is social distance and masked. We have more work to do.
Okay.
And we have to understand that our ultimate goal is to get kids in school and keep the schools open. And if we sacrifice now by taking too many liberties, by being too free and disregarding that advice, we're going to feel it in September.
Okay, two quick areas real quick. The first one is UT students. I understand that the university is going to great lengths to try to mitigate any impact that would come from university students that have a little bit higher infectivity rate projected than what we have in Austin because of where they're coming from around the country. UT is trying to urge students to accept the same discipline that our community has. But in that regard, and I understand they're going to be testing 5,000 students a week, so that if there is a spike or an issue, it gets identified early. What about the frat houses and the sorority houses? Are we doing anything proactively to help there?
Mayor, we are sending letters out this week to those individuals who've been identified as the site operators for the fraternity and sorority houses to remind them of their legal obligation to follow the guidance as site operators. They have a responsibility to ensure safety. They have that legal responsibility, and we are sending those out today and tomorrow. If we find violations, we will take action to ensure that those violations are mitigated and that those types of environments do not pose a risk to the larger Austin community.
On social media this weekend, there were videos that showed activity down on 6th Street. Are you guys looking at that?
Mayor, we are. We received the video as well. The video showed crowds of people. It showed long queues of people outside of a business who were clearly not social distanced. Again, it's up to all of us to be successful at mitigating the risk of COVID-19 in our community. And that means business owners need to be responsible, not only for what's happening inside of their facility, but also what's happening outside. And we were taking a closer look at that. We have reached out to Austin Code, the Fire Marshal's office, and our Public Health Environmental Health Service to investigate that.
Okay. And then the last question with respect to the Latino community, which is substantially lagging behind on overall infectivity. There was a report that came out from Austin Public Health back at the beginning of June with different strategies to pursue. I guess it's either for you or for Director Hayden. My understanding is that there should be a report coming out that kind of tracks that to say what we're doing or not doing, or what we're prioritizing or not prioritizing. So an additional way for the community to see what our strategy is with respect to the Latino community. I don't know if Director Hayden's still on.
I'm here.
Is that
Yes, we will have that to mayor and council on Friday afternoon. We've taken the document and we've readjusted the document just so it's a little clearer. And so we will provide that update to mayor and council on Friday. It will show things that the department has done over this time. It will show an increase of efforts that we are underway. For example, with the targeted zip codes where there is a high increase in positivity rate, we are providing PPE in those zip codes. But in addition to that, our environmental health, our restaurant inspectors are going back by those businesses to ensure that they have their signage up, and if they have any questions about their operations. We're also doing that same service for childcare facilities in those communities and providing additional education. So that's just a few of the efforts that we have underway. We are partnering with Community Care and Central Health on a marketing strategy, as well as Travis County, to increase all of our efforts of PPE. We are preparing a couple of PSAs that we will generate into the community. And so there are several efforts that you will see on the document that we will share. And if there are any questions, I'll be available to answer those questions. I couldn't hear you.
I say thank you, Director Hayden. Councilmember Poole.
Thanks. And thank you to Dr. Escott and Director Hayden for another really good and informative update. I just had three kind of specific questions. To get a little more proactive and less reactive on our data, I was noticing, Dr. Escott, when you were talking about some of the slides toward the end of the presentation, where the delays in us getting the numbers of tests results came in, and we didn't know first that there was a delay, and then we got them all. Can we maybe get real numbers on the dates those tests were either done or submitted, so that we could assign those numbers to the dates where they actually occurred, so we have a better understanding of whether we have a mini surge, or so we can get an accurate assessment of what the actual data is. Does that make sense? I'm looking for some kind of two things, both an early notice from the state testing center that they do have a backlog, and we should look for a large tranche of data coming to us later, and not not at the time that we had expected it? And then can we take the data that we got and reassign it to when those tests were either submitted or taken?
So council member, we can't do that because of the reporting nature of the state, which is that we report the cases based on the day that they're entered into the system. But the epi curve, which is on that main dashboard, shows the date of the individual when they started symptoms, if they're asymptomatic when the test was done.
Okay.
I will point out that one of the things to help display any delays is going to be the active cases.
Right.
So if the active cases are decreasing at the same time cases are increasing, that indicates that a larger portion of the ones reported are older than 14 days, so they're already recovered at the time. And this is exactly what we saw last week, which initiated that investigation, because we had one day with 350 cases reported and we had 303 recoveries in the same day. So that is a way to help tell the difference between new cases and old cases.
And what I would just say there is we need to have some active feedback in that loop to the state and let them know that we could use some additional distant early warning signals when something like that is going to happen. I understand that's their system, and it's more of a persuasive discussion with them, but they need to know how those gaps are affecting the people on the ground, the grassroots, which is what we are, and our transmission of that information out to our communities. Second question of the three I had on the zip code sort that you have. Can you pull up that slide? Was that, I guess, slide 10 maybe?
I'll see if AV can.
The question I have there on the zip codes, can that number show what the numbers of population are?
Sorry, go forward 2 slides.
There it is.
Yep.
So if I'm looking at this right, the ones on the far right, 76549, has fewer cases, personal cases, than over on the other side, 78621. Do we know what the real numbers are in those from the population distribution for those zip codes?
We don't have it broken down by population. Again, the team is working on a map, an interactive map, which will show positivity by zip code.
Right.
We can certainly see if they can do a measure based on population as well.
Well, the reason that's why I'm bringing it up, I've been following a couple of zip codes specifically in my district, and one in particular has been at the very bottom with the fewest number of cases for a significant period of time, and now I see it's kind of in that second tier with more, and I'm curious to see what the real number change in that is and what the percentage of the population of infection is by zip code.
Well, what you're seeing here is new cases in the past 7 days. So those are the actual new cases for that zip code.
Okay, so you don't have population percentages in there?
I do not.
These are just real numbers. Okay, well that would be an interesting piece of additional data. And then slide 7 seems to be incomplete, and that's the slide on the nursing home cases. Can you pull up slide 7? There it is. So that looks incomplete to me. And I was just curious why that is. We talked a couple of weeks ago when you all made the presentation about nursing homes. Mm-hmm. We requested that the nursing home names be added to this list, and that has not happened. I haven't had any feedback from staff at all as to why that would not have been done. The information is public. We had a discussion here in work session about adding those names, and I would like to see that done, or if it's not going to happen, and this may be directed to staff, I'd like to understand why.
Yeah, if Ann is on.
Councilmember Poole, this is Ann Morgan. We are still following the Attorney General ruling about the names of the nursing homes, and I'm happy to visit with you offline. I thought that our office had done that, so I'll get to you right after this meeting.
Yeah, I need to be able to close the gap between what the public is hearing from press outlets and what we are providing, since we are considered to be a pretty credible source of information, and it needs to be as comprehensive as it possibly can. I think a couple of us expressed that pretty clearly a few weeks ago. Yes, please have somebody give me a call. My cell phone would be great.
Will do.
Thanks, Mayor. That's it for me.
Thank you. Does anybody have their hand raised?
Yes, I do.
Go ahead, Ann.
Okay. Let's see. I have a few questions on nursing homes. Can you speak again to the trend rate? The reason I'm asking that is I had hoped to see the kind of dashboard on our website that actually shows trends, just like we are showing trends in our bar charts with the general population, and also how we're showing trends related to our minority population. But I'm not seeing that, so I'm having to look at raw data. I mean, I appreciate the data that you are making available, but now that perhaps we are seeing a little bit of relief in terms of the impact on our department, I would really, really appreciate a dashboard. And by a dashboard, I mean the only thing we're seeing on the COVID page is the spreadsheet you're giving us. The last one that is on the last one that's on our public page is August 4th, I think. So I appreciate what you gave us today, which is more of an update than that. But it would be really helpful if we could find a way to actually post some more user-friendly data that shows a trend, just like we're doing for these other areas with regard to our elderly folks. So that's a request that I have, that I've had that request for a while, and I haven't repeated it recently because I've understood how much of an how much under the gun our health department is in terms of what you're working on. But I'm hoping that there's at least a bit of a breather now so that we can be more transparent in the data that's available to the public. So my question is, so that's just a request. If there's something that we can do to help, please let us know. But we really need to do a better job, I think, of making that information available. So my question, though, is, can you tell me what is the trend in our nursing facilities, in our assisted living? If I was able to see a trend line, would it show us leveling off, or would it show us going down in terms of deaths and hospital admissions and infectivity in our long-term care facilities?
So Councilmember, I'll get with the team again and find out where we are on the dashboard. I would like to have that information available and accessible in the manner that you described, so that folks can follow that. Looking over the past several weeks, 3 weeks ago, our total cases were 89 for that week. Last week, it was 112. And this week, 58. Sorry, 111 last week, 58 this week.
Okay.
So it is declining as compared to the past several weeks. And again, we will continue to work and see if we can prioritize further the dashboard in a way that's more accessible and clear to you and to the community.
Okay, so can you tell from just looking at the past few weeks whether we are seeing an improvement for these long-term care facilities? Do you feel with confidence that you can say that we're declining at this point, or do we need more breadth of data to look at?
Well, I think right now we are declining. I will say that as community infectivity increases, so do the clusters associated with the nursing homes and long-term care facilities. And this is why it's important for us as a community to continue to try to suppress, push down that infectivity rate or positivity rate further, because it's, once it gets above 8%, 10%, it's really very difficult to have enough defenses up for those facilities that are really the most vulnerable. I am not happy about the number of deaths that we've seen over the past several weeks. Many of those are from our nursing homes and long-term care facilities. And, this is why we should not be celebrating right now. This is a devastating disease. It's devastated many nursing homes. It's devastated many families. And we've got to be vigilant. And that means we have to all compromise a little bit and do so in order to protect those who really can't protect themselves.
Okay, thank you. I appreciate that. So our last question then is, again, you spoke to this some, Director Hayden, but I want to make sure I'm understanding. So with regard to the assisted living facilities, do we know yet whether they're all engaged in testing or all have involved testing? I know our nursing homes have. Just curious about our assisted living facilities.
All of them have been involved in some level of testing because it is a requirement from the Health and Human Services Commission, especially if you are going to have visitors. So that is a requirement. In addition to that, we have provided testing to over 47 of the 75 facilities.
47 of the, I'm sorry. You said that earlier. So 47 of the 75 assisted living. Is that
Yeah.
Okay.
Yeah.
All right. Okay. Thank you very much.
Mm-hmm.
Colleagues, any other questions? Councilmember Alter?
Good morning. Appreciate all of the updates and pleased to have some good news. I wanted to get a better sense of how the city is supporting our schools. As a parent of kids in the schools, when you hear, at least for high school, what that looks like if you show up, there's really not much reason if you have access to the internet, et cetera, at the high school level to send the kids. And I'm just trying to understand how much we're working with the schools. They're very different needs across the different ages. And just want to make sure that we're providing them the support and knowledge that they need. My impression is that we are, but I'd like some more information about the details.
I'll start. So essentially, we have a weekly meeting with the superintendents across Travis County, some from outside of the county. We have had conversations with folks from charter schools. We've also had conversations and meetings with public schools, with private schools as well upon request. And so, as you know, the department put together the guidance that was submitted on the 14th of this month. Very comprehensive guidance, and each of them are using it and are really excited about the guidance. And are going to be able to provide those plans on their website. In addition to that, like with the nursing homes, we have set up an incident command structure. That incident command structure we've increased the number of nurses that we have, as well as supportive services. So when individuals call that line, they're able to get information in general about COVID-19, testing, et cetera. Within that plan, in the guidance, we've asked that there is a spot at each of the campuses, as well as a general spot for each school district. And so if folks have, general questions, we've set up a mailbox. And so they can email our staff and get assistance from them. We've also, within that incident command, just a little small incident command structure, we've also added our epidemiologists are assigned to that specific group of folks. So they're going to be looking at the number of cases that we will have coming in from the schools, and we'll be able to provide as much technical assistance to them. And then lastly, in addition to our EPI staff, our folks are establishing a task force for pre-K through 12. And so that task force will operate like the child care task force is operated. And so we'll have various representatives from the different school districts that will be a part of that. And so as things come up that affect each of them at that level, we'll be able to all work together on any kind of instances that come up. So those are the supports that we are providing to the school districts and the schools and charter schools, et cetera.
Councilmember Alter, I'll just add that one of the challenges that we have right now is that the superintendents, for the most part, seem very engaged in that gradual risk taking, starting at 25% and then gradually going up from there, to ensure that we can do each level safely before we move on to the next. We learned from reopening businesses that doing things too quickly is costly. And we are trying to avoid the same error in our reopening of schools. The challenge that we have is that that TEA has threatened to not fund those schools that go beyond their grace period. And I think what we need now is we need some more flexibility from the TEA so that it will allow communities like ours to use the approach that we're using, which is to go slow and steady and ensure we can do things safely. And I know that stress is being certainly felt by our superintendents around Travis County right now.
Thank you. And I totally agree that we need to be pushing the TEA and Governor Abbott to hold our schools harmless in terms of funding so that they can plan and deal with the many things that are thrown at him, and have been working through a group that I helped found just funded to do that advocacy. I think it's extremely important. So I appreciate you mentioning that. I did want to ask as a follow-up, there's a lot of movement around the country to move to outdoor schooling, and obviously in August and September times that's challenging in Texas with the heat. But as we move into later fall and even winter, outdoor school is an option, particularly for some of the younger kids. And I'm wondering, to what extent are we looking at using city facilities? We had a resolution at one point, I think, where we suggested, doing that, but are we exploring that with the schools as a direction? Because if everyone was outside, which much of the year you could do, the risks would be a lot lower for everyone, and for certain grades it would be feasible to do a lot of learning that way if they had enough space and access to sufficient restrooms where they could manage it. So are we exploring that and looking at that, or?
Our staff are working with Parks and Recreation as well as libraries to explore that. We've had a couple of those conversations with staff from the school. I think ultimately, as Dr. Escott, emphasized, I think the most important thing is to be able to scale up, to start at the 25%, where we have 25% of the population in the classrooms. But ultimately, staff are looking into that a little more. And if that is something that the school districts would like, we're willing to partner with them.
Thank you. I will make sure that some of our colleagues that are trustees are aware of that. And I have a good friend who's really active in the outdoor space if you guys are looking for additional information, please let me know. Thank you for all you're doing.
Mayor Pro Tem Garza.
I just wanted to thank Dr. Escott and Director Hayden for continuing to highlight the disparities that we're seeing in the Latino community, and also all that you've done to make sure that people are wearing their masks and supporting my office in asking for resources. Myself and Councilmember Kitchen, with Councilmember Kitchen's office, Constable Suits and Constable Morales were able to do a distribution where we were able to hand out masks and sanitizer, also the Greater Hispanic Chamber of Commerce. And I also want to recognize that the Latino community has lost some pillars in our community. We don't know if all of them are COVID related, but we all know that the Latino community, the African American community faced significant health disparities, regardless of what may have caused their death. We know that there are health disparities. And so we've lost Rabbit Duran, Johnny Limon, and Jesse Morales recently. And for those who don't know who all those people are, I'm certain most of us know Johnny Limon, who was an amazing advocate for housing and Tejano music and just a positive ray of sunshine. We get all the spectrum of advocates, and we love all our advocates, but Johnny was always so positive and such a great person. He will be missed. Robert Duran, he rabbits in East Austin. I'm sure many of us maybe had gone to that cantina. It's now a different place, but I actually, met a lot of people in politics gathering there and strategizing and talking about how we could get more Latinos at the table. So I'm grateful for all he did to help mobilize Latinos in politics. And then Jesse Morales, who is the father of Constable Morales, a big supporter and always quick to tell me when I was doing something wrong, but also quick to tell me when I was doing something right. And so I'm sure I could speak on behalf of the council, all of us, to send our condolences and love to their families in this very difficult time, and know that we really are doing a lot behind the scenes, talking to all our staff. Our staff is doing so much. This isn't an Austin problem. This is a problem in our entire country, that our Black and brown communities are on the front lines doing all the essential work and the ones being most exposed. And I really hope it sheds light on the equity work that we need to continue to do as a country.
Thank you, Mayor Pro Tem. I think we all second your sentiment. Further discussion, further questions for Dr. Escott or Director Hayden? Then Councilmember Ellis, and then Councilmember Renteria.
Thanks, Mayor. Really appreciate getting the most up-to-date information we have. Is there any indication from the state that there's a commitment to turn that information back to us quicker, or is it a matter of their processes to make sure that we don't have this backlog where we're getting data results sometimes months later? Have they said exactly what caused that particular concern, and if there's any steps that they can take ensure that doesn't happen?
Councilmember, the challenge was that the state electronic lab reporting system was not built to have the capacity for tens of thousands of tests a day to be reported. What that meant was, particularly during busy times of reporting, that some of those labs were not reported. Since then, they have substantially increased the capacity of that system, so we don't anticipate running into the same issue in the future. So they have updated the system, but I think as we've discussed many, many times before, the investment in public health infrastructure in the United States is woeful. And I think if COVID-19's taught us many lessons But amongst them is the fact that we really do have to have a strong infrastructure, and we have a lot of work to do.
It's good to hear that they've taken some steps to fix that. I've also heard similar issues with the Workforce Commission, which is not what y'all are here to brief us on, but antiquated systems, computers that can't handle the load that is being demanded of them right now. On some of these charts, yes, it is good to see these numbers coming down, but I really, really hope that what people take away from this conversation is that you need to continue to stay home and wear your mask. We're not in a space where we can say we're in the clear. What we need to do is keep doing what we're doing. And so I know that you, Dr. Ascott, and Stephanie Hayden have been advocating for these measures. You've said it in multiple ways on this particular call, but I just want to reiterate to people who are watching that the coast is not clear, and you need to keep doing what you're doing to make sure that we continue to flatten that curve as much as possible.
Councilmember Renteria.
Yes, Mayor, thank you. And I want to thank both of y'all, Dr. Scott and Stephanie Hayden. But mine is more of a comment than a question. There's if we're losing great leaders here, but we're also losing friends and families here in our community. And when my whole plea is to the coaches out there that have these little soccer leagues and they coach the little kids out there, and I see them out there without no mask. Families gathering, it's hot. They all hang out underneath the tree. It's just real sad that people are not listening to what we're trying to tell them to do, is to how to stay safe and keep losing our families. When I see a soccer tournament going on where there's over 100 people out there in this hot weather, and there's about 3 or 4 trees, where they're going to gather at, all underneath the tree with no mask. And coaches, this is just irresponsible. We ought to have these kind of tournaments out here in this hot weather with our kids. And these are people of colors that are doing this, and we're the ones that are getting most infected. And when I keep seeing these kind of activities, it just breaks my heart knowing that these kids are going to go home and they're going to infect their parents or their grandparents, and us in East Side here and the people of color, with this virus happening and people getting losing their apartments and having to move in back with your family, with your mother or your grandfather or grandparents. Y'all have to, there's a responsibility that we need to take. And coaches, please don't do those kind of things. I know there's a lot of pressure and you want your kids out there, and to get the training and the development that you want to see them to become successful. But this is not the right time to do those kind of things. And I'm pleading for y'all to please take in consideration when you do these kind of tournaments that you do social distance. And you make sure that you tell the family to bring their own shade, because it is too hot out there to be doing those kind of things. And people will be, all gathering underneath the shade. So I'm just pleading with them and hope that you really use some common sense when you do these kind of things.
Mayor, you're on mute, but I think I read your lips.
That's right.
I want to thank the Mayor Pro Tem for her tribute to Johnny and Rabbit and Mr. Morales. And thank you, Councilmember Renteria, for reminding our families about what it is that we need to do. Dr. Escott and Director Hayden, I know you've addressed some here today, and Mayor, the important focus on the Latino community and on communities of color generally. I I think that we do need to sort of double back on what, because we've seen some of that in the conversation today, how much of it, as we see cases drop, but we see this lag in places like the Latino community. Really, if we can start getting to a breakdown of how much of this is on the job, how much of this is in gathering, so that we can really get that information really clearly to people. We know that people need to be careful in both settings, but I think that information would be really helpful. I think it also would be helpful. Some constituents started putting together on their own per capita data on some of these zip codes. If we could get that officially from the city, that could be helpful, because sometimes we see a zip code on a map that's a certain size, but we don't always know how many people live in different sizes of zip codes. So that per capita data for zip codes may be helpful, because some folks that may see a zip code and may not see as many cases may not know that actually per capita, it's a really, really high number. So some of those pieces of information I think could be helpful if you could get it to us, so that we can continue the targeted work that I know the city is doing. And then also just a PSA that tonight at midnight, people is the first deadline for the first round of rent funding. And so for people who have not been able to pay the rent or are going to have trouble paying next month's rent, please go to austintexas.gov/rent. And council members, please do share that information as you can. There will be more rounds of funding, but this first round is really important. So again, we know there are people who are out working or putting themselves in harm's way because they're worried about paying the rent, and we want to make sure that the city can help them.
Thank you. One last question. Director Hayden, what does the epidemiology tell us about the contact tracing? Where are our clusters in the city?
We are seeing more clusters with our retail, but we're also seeing it in our financial area with real estate. So we're seeing more cases where individuals may be renting or leasing apartments. And so our staff have been reaching out to those individuals, and we've provided some additional education as well as some educational material and then flyers for them to put in their lobbies and waiting areas, because those are the main areas that we're starting to see them.
Thank you.
Mm-hmm.
Any other questions before we let these folks over to the county?
Yes, Mayor.
Yes, Councilor Tobo.
I just had a couple of quick questions to follow up on yours about the about plans with the institutions of higher learning. Do you have a sense of whether campuses like UT and St. Edwards are making plans to have isolation facilities on campus, or are they going, if they have students who are testing positive, are they going to be utilizing the City of Austin's isolation facilities?
They are going to be using the City of Austin's our ISOFAC. So they will be using that. And those are specifically for folks that are on campus.
And so when you are interacting with, I know Dr. Escott indicated that he would be communicating, or that a letter has gone out from the public health department that should be arriving at fraternities and sororities this week. What is the messaging to residents of those houses? Are they, if in the event that I hope unlikely event where somebody would test positive, what are their options? I assume they would have the same option other Austinites do of being in touch with public health and isolating. But is that a message that we're communicating out to the and sororities, that that's an option to them, and if they have a resident who tests positive, that they should get in touch with public health to see about quarantining in our ISOFAC?
Well, that message that is going out is going to just provide information about all of the orders that are in place for Austin right now. that information will also include a copy of the orders. We have received a request from UT, and we are going to meet with them. They have over 31 fraternities and sororities that we are going to meet with. They provide a health and safety document that they provide annually to the fraternity folks that live in those homes. And so they're going to provide that, but they're going to get some additional information from us. So in that document, they are going to provide that additional information about, you know, if you test positive, where you would go, what number you would call, and how you would access those services. And the goal is for us is not just for the University of Texas, but we are, our plan is to continue this with the other universities that are here. We feel like it is very important for us to ensure that they have all of the information that other residents have received thus far. And with them coming back into town, we want to make sure that they have the most reliable education that they have, and then they know exactly what to do. So whether it's the health and safety or the enforcement, we are going to provide that as well.
Great. And as you look at other kinds of group living situations, I know some of the West Campus apartments, for example, have common areas and other kinds of spaces that are very often shared amenities. Are you communicating with those large complexes as well?
Yes, we are. We in the past we've had several conversations with the management of those operations. They've been very cooperative. They've closed down those amenities and, you know, informed their residents that this was not an option for them in the past. And so we feel like we have a really good relationship with them. So we'll go back to them as well to provide that additional information.
When do you think that kind of outreach is going to take place with the sort of private, you know, non-campus related apartments throughout the city?
So
that might be helpful.
we're going to be working on that this week and next week to get all of that information out to them.
Great. And just to underscore something you said, the outreach of public health is with all our institutions of higher learning, not just UT, HT,
Yes.
it's all of the colleges and universities within the area. Thanks for that. That's a big undertaking. And I just wanted to close by saying thank you for addressing some of the urban legends about COVID. I think that's really important as we continue to have, you know, really try to understand how this virus operates and how best to protect ourselves and our neighbors. Thank you for really just Dr. Escott for calling out some of the myths that are circulating.
Any further discussion before we let these folks go? I don't see any hands. Dr. Escott and Director Hayden, thank you so much for giving us the briefing today. Thank you.
Thank you, Mayor.